Bismillahirrahmanirrahim. Assalamu alaikum. Myself, Munir Rahman. Today I am going to present a case of vaginal fold prolapse in a dog with pyometra and ovarian papillary cyst adenocarcinoma. The case was represented with a history of 7 years old, 42 kg, sexually intact, nulliparous female Italian Mastiff was admitted with a 3-day history of vaginal prolapse. The condition had been recurring at estrus since age 4 but resolved spontaneously. No hormonal treatment had been administered. In clinical findings, physical exam was done and we found that the dog suffered from type 2 vaginal fold prolapse. Ultrasound was done for confirmatory diagnosis and ultrasound showed enlarged uterus, cystic right ovary and a number of corpora lutea on the ovary. Hematology showed leukocytosis, neutrophilia, mild anemia and low hematocrit. After that, we checked the concentration of hormones in serum, which showed progesterone 9.36 nanogram per ml and estradiol 30.42 picogram per ml. After that, cystic fluid was examined and it showed progesterone was 72.72 nanogram per ml and estradiol 792 picogram per ml. Now it is the differential diagnosis and diagnosis. We diagnose the type 2 vaginal fold prolapse from these conditions. First is the true vaginal prolapse. In true vaginal prolapse, all the 4 layers of vagina are protruded from the vulva. And then uterine prolapse. In uterine prolapse, the uterus was protruded from the vulva alongside the vagina. And then the clitoral hypertrophy. In the clitoral hypertrophy, the clitoris was enlarged. And then the condition is a vaginal and vestibular neoplasia. In vaginal and vestibular neoplasia, there is a growth in between the vestibule and the cranial vagina. And after this differential diagnosis, we diagnosed that this condition was type 2 vaginal fold prolapse with concurrent pyometra during diestrus and ovarian papillary cyst adenocarcinoma confirmed via histopathology. And next come the treatment and management. In treatment, we performed variohysterectomy. After variohysterectomy, vaginal tissue was repositioned and retained using a modified Bonner suture. And after this operation, the most important thing is the postoperative care. In postoperative treatment, we administered the carprofen 2 mg per kg for 3 days and amoxicillin plus clavulanic acid 8.5 mg per kg only on the day of surgery, not in the whole post-operative care. After that, amoxicillin and clavulanic acid with the dose rate of 12.5 mg per kg for consecutive 6 days. The retention suture in the valvular lips was removed 14 days after variohysterectomy, and E. coli was isolated from the uterine fluid culture. Now here are two pictures. The right picture showed the Bunner sutures and the left picture showed the two papilliform projections in the cyst. After that, histopathology was done and the histopathology of uterus showed severe cystic endometrial hyperplasia and inflammation. The histopathology of right ovary showed papillary cyst adenocarcinoma with hormone secretion. The estradiol and progesterone produced locally contributed to pathology. Then the last but not the least part is the outcome. Vaginal prolapse regressed completely by 35 days post-surgery. No complications observed at 5 months follow-up. The dogs remained in good general condition. Thank you.